All right, welcome. I'm Mark Slater from Prime Spine Consulting, and I am so honored to have with me Dr. Chris Connelly. Dr. Connelly is a practicing chiropractor here in Atlanta, Georgia. He's on the forefront of traumatic brain injury and concussion. He's actually the CEO of a company called Braincussion, and by CEO, the Chief Education Officer. He has multiple other businesses, but this conversation is going to be wrapped around how chiropractors and other pain doctors can have a TBI protocol in their office and the value that brings in the personal injury space and the personal injury industry. And so, Chris, welcome to today's interview. Tell everyone a little bit about you, about your history, and what you're currently doing now in the space of personal injury, specifically TBI and concussion.
Great. Well, thank you for having me. And so, I've been a chiropractor for 26 years. Over that time, I've seen thousands of patients in trauma, motor vehicle collisions, sports injuries. And one of the things about 7 or 8 years ago, I found is that we're missing a lot of patients who have brain injury. And one of the hallmarks of my practice over the years is a good diagnosis is the first step to a great treatment. And that's true in clinical practice, but it's also true in the personal injury world because it's important to be able to say what's the actual tissue damage related to a particular trauma. So maybe about 7, 8 years ago, I started being more aware of brain injury. I was actually the only chiropractor in the country to use a machine called BrainScope. So I was trained in BrainScope, and the only other clinic here in Atlanta using it was Grady. So it's a big hospital system here. So I got trained in it, got trained by the VA, got certified as a brain injury specialist, and I started really noticing, wow, these patients, they had upper cervical problems, but they also had brain injuries, and just really dove deep into the brain injury world, and also what are the best practices to help patients who have brain injuries.
Got it. And so we talk about this concussion and talk about the difference between, we watch these football games, football season is almost upon us, and talk about the difference between concussions that are sustained in, let's say, football games versus a one-off concussion sustained in a car accident from, like a T-bone accident, or let's get into that.
Yeah, and that's a very common question. And, the forces are significantly worse in motor vehicle collisions, particularly side impact, airbag, and the velocity, the speed, and the forces are significantly higher, even in boxing or football, because of the fact that they're human on human typically. But if you have a impact with a car, it tends to be a lot faster with a lot more force. And the brain tissue has something called viscoelastic properties, and so do the facet joints. But the brain tissue having viscoelastic properties mean normally over time they stretch nice and slowly. And so what happens is with rapid acceleration, deceleration, those axons shear and they tear. Also, you could have microbleeds. But what happens with those type of brain injuries is that they wind up causing a metabolic change, particularly within the mitochondria. And that's why most of the time patients feel tired, they have sensitivity to light, they have headaches, sensitivity to noise. And you start seeing the initial stage of a concussion as a excitability at the beginning, and then after a couple hours, it goes into a fatigue aspect of it. And so, but it's the forces involved with it that lead to the brain tissue injury on an exoplasmic level, and that winds up being too small to really see on a lot of imaging. And that's why we do functional tests to really see how the brain's functioning. But also, if left uncorrected, then those metabolic changes, the lack of blood flow to the brain, over time lead to persistent post-concussive symptoms, but then also cause neurodegenerative changes. So that for the patient's health, it's really important to increase the mitochondrial efficiency and the metabolism in the cells, and also increase the blood flow to the brain.
Got it. So 56% of these TBIs are missed in emergency rooms. And chiropractors and doctors in the personal injury space now have an opportunity to diagnose or get the ball rolling on a TBI or concussion diagnosis. And so the question is, are chiropractors allowed to, is this within their scope to handle this type of injury or event?
Yeah, and the college or the association that accredits chiropractic colleges and universities has issued a statement, I believe you have that says chiropractors are trained to diagnose concussions and to manage them. Also, the Board of Examiners has issued a letter saying the same thing, that we are trained to be entry-level providers and be able to diagnose them and help with treatment. Now, that being said, I saw the need for neurologists and neuropsychologists. So when I started 7 years ago seeing a lot more brain injury patients, I would get referrals from all over the state. And it was because we were doing brain injury assessments. And then later on, we were able then to refer them to the medical providers. And we had a very great medical facility here that wound up seeing patients and even on lean. And then they wound up not being able to see those patients again. So I saw a need to have access to care for patients.
Yeah. And in terms of personal injury, have you seen a greater value driver for personal injury cases in TBI or concussion?
Well, the most important thing about value drivers is what's the diagnosis?
Right.
And does it lead to a permanent impairment rating? And, but brain injury is a value driver in a AI Colossus-based system. And when a patient has it, it's really important to diagnose, for their health. And, even years ago, I do defense work and plaintiff work, and I've reviewed thousands of cases. And this one defense attorney, I said, what's the magic formula? What's the important value driver? And they said, have a real diagnosis that would have been caused by a collision that we feel is appropriate. And brain injuries, the third leading cause of brain injury are motor vehicle collisions. And it's been missed most of the time in practice. I see it all the time where it's missed.
Yeah. And because this is a big value driver, and let's say I'm a chiropractor and I want to get a TBI protocol in my office, what does that typically look like? Do I have to buy special equipment? Like, what is the order of operations that meets, and we can talk about this, the DAW-BEAR standard of care with the TBI protocol? So walk me through the process of when a patient comes into the office. It's a new patient. You don't know if they have a concussion. They may or may not. So what is the process? What is the modus operandi of this process to determine if they have had a concussion or TBI from this accident?
Well, first of all, education. There's a lot more education, and I can provide references for you as far as either being a certified brain injury specialist, the VA training, the CDC training. There's a lot of programs on training what is a concussion, how to help diagnose it, and what are the best practices to treat a patient. So first of all, patient care is really important to be able to assess what's going on. And so, but from a standpoint of when a patient comes into the office, we have something called the Stanford Postconcussion questionnaire. And we do that on every patient. And when we do that on every patient, we wind up screening and say, looks like they have a concussion, or no, they don't. But you also, anxiety, depression is also very common after motor vehicle collision, and sometimes they overlap. So that's why it's important to have a clinical examination and do a good clinical examination on them. At that point, then we do something called a quick impact. So quick impact is a great tool. They even have training for chiropractors. And when you do the test, it assesses if they have a concussion. It's meant to be for sidelines or for clinics, that they could do the testing that the regular impact does in a lot quicker of a time. And so the nice thing is you get a great test that's FDA approved without having to have a lot of expense. At that point, I always recommend refer them to a medical doctor. Okay, even though we're trained, even though we're okay to diagnose or even do some treatment, particular lifestyle medicine, it's always better to refer to a medical doctor when you see someone who has a brain injury. And that's important in multiple steps, but it's most important for the patient's health. Next, it's also important because the value drivers, what would you do if this wasn't a car accident? If someone has a brain injury, you're going to say, I'm going to send them to a neurologist.
Yeah.
And so Braincussion has neurologists and neuropsychologists in over 40 states. So we do everything telehealth. And the good thing is we give patients access to care. Study after study shows one of the biggest things that they have is, one is that they don't get diagnosed. Number two, they don't even have access to care. So many studies show that about 50 to 60% of patients don't get the accurate entry-level diagnosis. But even the patients that do get diagnosed, they don't get the appropriate follow-up care for up to 6 months after the collision. And so, one, that early diagnosis is important, but also they need to have access to early care. And through Braincussion, we've been able to give them that access within a couple of hours or days, but also they'll see a qualified brain injury specialist, to be able to help manage their case.
Okay, so let's just review. So the first thing you do is you establish through a questionnaire, a post-concussion questionnaire, whether it's the Stanford questionnaire, that's what you use. I've heard of the Rivermead questionnaire, and it's based on a point system, correct?
Yes, so basically you look at it and see if it looks like that they have multiple symptoms of a concussion.
Okay, so once that reaches a threshold of a certain point scale, you're gonna do the impact test, which you can get certified pretty inexpensively, you mentioned, correct? The impact test to get certified is, for chiropractors, not very expensive, correct?
Correct, and it's called a quick impact. So the regular impact does have to be interpreted, and one of our providers actually teaches for impact on how to interpret it. He's a neuropsychologist, went to Harvard and military and stuff. But what we need to do is we do the entry level screening, then you do the quick impact. The quick impact, I believe, is about $1,400 a year, and you can do unlimited testing for that $1,400.
Okay.
But they provide the billing and the coding information, as well as how to read the tests.
Okay, so they handle all that for you with the certification.
Yes, so Impact is wonderful. They've been great. They've taken everything they've done in the sports injury world and applied it to the motor vehicle collision world, because brain injury is a brain injury. It doesn't matter if it's a sports injury, if it's a fall, or if it's a motor vehicle collision. And so they've been able to sort of just take everything they've done in the sports world and apply it to motor vehicle collisions.
Right, and impact test, like you said, it's used by the NFL, the NHL, NASCAR, the NBA. So it's a common test, and more importantly, it is an FDA-approved test, correct?
Correct, and it's important with the FDA is that a test is not a standalone absolute. It has to have somebody to interpret it. And
right.
So when you're doing the quick impact, they give you the training to be able to interpret it. But then when they do the regular impact through Braincussion, what happens is we have providers that will sit and have them do the test. And then we actually have doctors that are trained by Impact interpret the impact test. So it's sort of like getting an MRI or getting an X-ray. The X-ray has to be interpreted. The same thing with the impact test. But they teach providers how to interpret the quick impact. And Impact is a great organization. They've been great partners for us, but also they're just a wealth of information.
Right. So the impact generates some type of report, or it generates a interpretation based on the patient taking the test.
It tests how the brain is functioning, yes. So,
okay.
So we think of brain injury as a structural injury, and most people don't have bleeds. But even a CT scan only detects a brain bleed up to 3 millimeters of blood. So even if it's a small bleed, it may not show up. But a brain injury typically has more functional problems. So Impact is specially designed to help detect where the functional problems are.
Got it. So after the impact test, the FDA approved test, Braincussion is a company that, like you said, has medical neurologists in over 40 states. And the patient can do a telehealth visit with a medical neurologist through Braincussion. And is there a fee for the doctor by using Braincussion? How does that part work?
Sure. So basically, they just send a referral into the entry form. I can make it available to your clients. And basically, then they reach out to the attorney and they explain the process. And they will send them, everything that they need to approve it. It's always approved. It's not just done. And it's about the same cost of an MRI. So it's really not that expensive. But they get the diagnosis, they get the evaluation, the treatment, all wrapped up into one visit. And so they also get the education, what to do at home and what not to do at home.
Got it. So they get it interpreted by a medical neurologist. This all meets the Daubert standard. And then what's the next step after that? Like an impairment rating evaluation, is that typically the next step after the impact test, the Braincussion interpretation by the medical neurologist? What's after that?
Well, the treatment, so many times through proper treatment, the symptoms resolve or go away. but there's still a long-term neurodegenerative change in the brain that occurs. And I like to think of it like rust. So if you have a car that there's an impact and there's a dent in the paint and that metal has crumbled a little bit, it's functional, it's fine, it may not look the best, but what's going to happen over time, that metal could rust. So because of the metabolic changes in the brain, because of the reduced blood flow to the brain in those areas, that brain tissue over time can deteriorate. And that's why it's important to normalize metabolism in the brain and to increase blood flow through exercise as rapidly as possible to minimize the long-term neurodegenerative changes that occur. And many, many studies have shown this. And this is why the CDC has referred to traumatic brain injury as a silent epidemic, and that most people get an injury, the symptoms may reduce or even go away, maybe 70% of people. And over time, though, they start having symptoms. And it could even be seizures, it could be other things. And it could be weeks, months, or years down the road, you start seeing the effects of the neurodegenerative changes in the brain due to the lack of metabolism, mitochondrial deficiency, as well as the blood-brain barrier, and also the lack of blood flow to the brain.
Got it. So after the musculoskeletal treatment is over for the sprains, the strains, the ligaments, instability, all that, these people may still have some symptoms. Well, just talk about when the musculoskeletal treatment is over and the majority of the TBI symptoms have, I don't want to say minimized, because these symptoms can last for years. So what happens after, the treatment is completed?
Well, when they've reached, it's called maximum medical improvement, meaning it's as good as it's going to get.
Yeah.
So every tissue has a certain time frame you would expect them to heal. And the next step in that is to do an impairment rating, to sit down with them to say, what's the permanent nature, permanent injury, permanent diagnosis going forward? At that point, then that's called a permanent impairment rating, meaning it's expected to last until death. So typically for a brain injury, you want to wait at least a year, maybe even longer before you call it permanent. For spinal injuries like facet, depends on what's going on with them. Like if they had radiofrequency neurotomy or facet injections, maybe it's 8 months to a year. But typically with impairment ratings, you want to make sure that you give it a long enough time afterwards that it's called maximum medical improvement. I've been involved in some defense reviews that I've been expert on, and they give the impairment rating on the first visit. That doesn't make sense. Okay. So an impairment rating has to be when they're permanent in a state that's not going to change over the next 12 months to the rest of their life.
Okay. So the chiropractor has wrapped up the treatment. They've done the Stanford questionnaire, the impact test. The patient has had a telemedicine visit with a medical neurologist through Braincussion, your company. Treatment has wrapped up. They've gotten an impairment rating, and let's say it's a 5% whole body impairment, but that impairment is the brain. When that lands on the attorney's desk, let's say it's an experienced attorney who knows how to handle TBI, and my scenario just happened and it landed on the attorney's desk. What is the attorney going to do with that? And let's talk about the value of the case now to really help this patient, because they may have ongoing symptoms. So what is the attorney going to do?
Well, one, you hope that the attorney is informed on what an impairment rating is, or even what a brain injury is. And then basically, it helps them to quantify the loss. And an example I like to use is a car. So say someone steals your tire. If they steal your tire, what percent loss of that is of the car? What percentage of the car is that's been taken away or stolen? Well, the tire may be 2%, 3% of the car, but then what's the disability? The disability is pretty significant.
100%. Yeah.
Yeah, and so you could drive on it, but you're going to tear up the rims and cause other problems. So, I like to explain in that sense because of the fact that it signifies a loss is the impairment rating. That's what's actually taken away, no longer part of that person. That person has been reduced in value. But then the disability is what are the effects of the impairment. Many times I hear people, they use impairment and disability interchangeably, and that's not correct. Right. And so, and also it's progressive in nature with a brain injury. So sometimes it could actually progress over time. And, I've done hundreds, if not thousands, of impairment ratings. And brain injury is one of the most complicated to do because of the fact that there's so many attributes to the brain. And the AMA Guides to Sixth Edition does a great job of going through it, but it is quite complicated. But yeah, it's a permanent loss. It's something you never expect that's going to get back again, and the person's not the same that they were before the collision.
Right. So if this person's going to need, they may need ongoing care, correct?
Exactly, and the impairment rating helps to signify that this is something that will need ongoing care. And even if you think about going forward in an artificial intelligence type world or a Colossus-based system, those are all things that will open the door to be able to say, look, they're going to need future care because they have this permanent injury. If there's no permanent impairment rating, then why are they getting more care? Well, I don't know, their back hurts. Well, pain is not necessarily an impairment rating. You have to say, what's the tissue damage and how is that causally related to the said trauma or impact? And is that reasonable? And then what's the long-term nature of this impairment?
Right. So if they do have tissue damage, or we're talking about tissue damage of the brain that may need ongoing neuropsych evaluations, neurological visits, maybe ongoing physical therapy, the attorney can hire what's called a certified life care planner, who will put together, interview all the doctors, interview all the family members, interview the patient, of course, look at all the medical records, and put together for the attorney a life care plan because of this brain injury.
Exactly, and some of them can be pretty expensive, and but it all starts with get a good diagnosis, do the proper treatment, what's industry standard for those types of injuries, and then that step, then the impairment rating quantifies what's the loss, what's been taken away from that person, what's no longer the same, what's permanent. Mm-hmm. The disability evaluation would sit and say, how is it affecting their lives? The medical cost projection, or you could have a life care plan, will discuss what are the financial costs going forward for that loss. But all of those are logical steps that go hand in hand, because if you just say, they have neck pain and they need chiropractic care for the rest of their life at $1,000 a year for the next 30 years, that's not really enough. You want to be able to quantify what's the actual tissue damage, Facet syndrome. They're going to need this and that for the rest of their life, but also they're having problems sleeping. They're having problems doing yard work, their job, things of that nature. So you want to quantify what the loss is, but then the life care plan comes in and says, what is that loss going to cost?
That's right. And how does that impact? Because I hear a lot of chiropractors say, well, the patient only has $25,000 of policy limits, or even low policy limits. How does TBI fit into that with a policy that only has $25,000 of policy limits?
It's tough. It's very difficult, especially with some of the low policies. And I've seen people paralyzed and there's only policy limits of $25,000, and it's heartbreaking. But yeah, it's something where that's where Braincussion, we communicate and we always get approval from the attorneys because of the fact you don't want to get in the situation. But even if it's a low policy case, the cost is about the same of an MRI. And if someone's going to have a brain injury versus they're having maybe some lower back pain, a lower back MRI may show a bulging disc, which may or may not be related to a collision. The study shows it's most likely the facet and less commonly the disc, unless they're radicular symptoms. But, Braincussion evaluation would be more fruitful for the treatment and the diagnosis, plus the case value.
And have you seen these diagnoses done the way we've just explained it, FDA approved exam, medical neurologist evaluation? Have you seen cases where these diagnoses and life care plans have popped policy limits and gone way beyond them?
I have, and also it's important too because early diagnosis is good for the patient, but also helps the attorney set the reserves properly with the adjuster, and that's an important thing, is setting the reserves. But there are some adjusters that still maybe are unaware or ignorant to the fact, but people don't have to lose consciousness to have a brain injury. And I've seen it where the policy was only $25,000 and they got $100,000, $150,000 because of the fact that they didn't take the brain injury seriously. And then later on they were, oh wow, it was a brain injury, I should have paid the policy, and then they had to pay an excess for it.
Yeah, and have you seen $1 million settlements from car accidents with TBI involvement?
Oh, definitely, definitely, and even bad faith. But again, it all depends on the workup. You get a good diagnosis, and that's why what we want to do is help chiropractors train and assess for a TBI. We don't want them just to send every single patient. If they don't have a TBI, we don't want to see them.
Of course.
So that's why the education is really important. But Impact does a great job with helping the patient to screen. So just like a cancer screening, if someone does a test and it looks like it's cancer, what should they do? Refer it out. But they have a clinical tool to say it looks like it could be something more serious. And the same thing with a brain injury test using that formula we talked about. Do the Stanford Concussion questionnaire, the River Mead, any test you want to do, the screen, do a clinical evaluation and get the chiropractor trained on what to look for a TBI. Do the quick impact. At that point, you have good reasonable certainty that there's probably a brain injury, and then refer it to the medical provider or the neuropsychologist for confirmation. And in testifying in court, I've had that before too. Dr. Connelly, why do you refer this patient to the neurologist? Well, I did my screening. It looked like it was a brain injury. I'm a chiropractor. We screened for it, but I'm glad I sent it out because they confirmed it was a brain injury. That's reasonable. That's also standard of care. In fact, I think it's sort of malpractice if you don't refer out, because what could happen if there's a bleed? What can happen if there's other things like that? So just like cancer, if someone has cancer, you want to refer them out as quickly as possible.
Yeah, so important. So it's a win-win-win. Having this as a chiropractor, it's a win for the patient because you're getting them screened for something that could be serious. It can lead to early onset dementia, early onset Alzheimer's, Parkinson's disease. So the patient wins by the chiropractor having the ability to make this assessment. It's a win for the chiropractor because it makes him, and I'm going to come back to this, it's going to make him attractive to attorneys compared to the chiropractor down the street that does not evaluate in personal injury for a TBI. And it's a win for the attorney because if done properly and it's the right case and everything lines up, it can get them over $1 million settlement. So everybody wins in this scenario. But Chris, you told me a story, and we're going to wrap it up here soon. You told me a story about when you first started doing a TBI in your office in Stone Mountain, and you mentioned how many referrals you got within the first few months. Can you share that in this interview?
Sure. So, we were the only chiropractic clinic in the country to have BrainScope. Medically, there was really no one assessing for brain injury for motor vehicle collisions. And even the medical ones that were brain injury would say, I'm only taking health insurance. So again, maybe 8 years ago when I started doing a BrainScope, and literally just by doing good patient care, having patients go back to the attorney and say, man, they do great care, the brain injury work, marketing to the attorney saying we assess, we really screen for this for people who have brain injury, and helping them recognize too, look, if it's a T-bone collision, if it's a side impact collision with a spin around, if it's a rollover collision, this could be a brain injury. And, we had tremendous success. And, I remember 1 month we had about 140 new personal injury patients. Just
in 1 month.
In 1 month. Yeah, 140. And just because of the fact that, they knew we would take good care of them, we would screen them, we would treat them appropriately. But also we had an FDA tool that was able to assess patients with brain injury. And I mean, the seriousness of the injuries were just insane, And in fact, I had a cover doctor once, and she actually said, wow, I've never covered at a chiropractic office and saw such serious injuries. I mean, people with, cuts and stitches and face all blown up from the airbags and just crazy injuries. And normally these patients don't get access to care, or they just get run through the mill and they say cervical MRI, lumbar MRI, and they get missed for brain injury. And so it's our pleasure to help take care of them and to really give them good quality care. But if you focus on good quality care, good diagnosis, and FDA approved and the good practices, the attorneys will send, because that makes their job easier. It's not going to be something that just bogus or something that somebody made up.
Right.
And, but yeah, so, it was one that we had patients coming from Tennessee, patients coming from Alabama, that they would come just for the brain injury assessment. And that's one of the reasons why when COVID hit, it was a logical solution to go to telehealth.
Mm-hmm.
And I don't do anything clinically with Braincussion, but we have neurologists and neuropsychologists that do. And some of the best I feel in the country, even that teach for impact. But telehealth gives access to good quality doctors anywhere really in the country.
And do you get any pushback from these attorneys that say you're going to set them up with a telemedicine visit with a medical neurologist to evaluate the impact test? Any pushback from that, or talk about that for a second?
Well, I mean, some would prefer in person, but even Shepherd Spinal Center here in Georgia, they're one of the best spinal cord and brain injury places. Most of their stuff is telehealth. Yeah. And a patient who has a brain injury shouldn't really be driving, and they need access to great doctors. So there's really not much pushback. Maybe once a month someone will say something. And in Georgia, and I think many other states, there's actually state laws saying that if something is done telehealth the same way it's done in person, it gets reimbursed the same way. So there are state laws that say telehealth is the future, and it gives access to care that patients wouldn't normally have. But we don't really get much pushback. And if we do, it's very occasionally, but then usually we give them the state law and they say, okay, I didn't know about the state law, and then they're fine with it. Patients with brain injuries shouldn't be driving. Patients with brain injuries don't have time to sit in the waiting room. With patients with serious brain injuries, I mean, it's physically and mentally just taxing. I've had patients sit right over there that we had to turn the lights off down. They had to wear sunglasses. The headaches were just so bad, and so when someone has a brain injury, telehealth is probably the best thing because it gives them access to care without having factors that may increase the risk of future injury.
Yeah, exactly. And well, Chris, over 50% of these TBIs and concussions are missed in emergency rooms. And what you're doing, what I'm trying to do for my clients, is be the solution to that problem and help these people that may have this diagnosis. So, Chris, Dr. Connelly, I want to thank you so much for doing this interview. I know it's going to add a lot of value, not only to my clients, but to my clients' practices who do it in the way that when it lands on the attorney's desk, it meets the Daubert standard with the FDA-approved impact test, for example, telehealth visit with a medical neurologist, and then eventually an impairment rating. And when it lands on the attorney's desk, that's how the attorney can get a big settlement, get the chiropractor's bill paid, but also be an attractive offer for the attorney. If he has car accident patients that live or work within a reasonable distance of your office, you're going to be their preferred provider because you are offering this service that very few chiropractors out there in the market have.
Exactly, and you differentiate yourself, but like I said, also partnering with Impact, that's great. Doing the quick impact test is wonderful. But doing good patient care, there's so much available with TBI and brain injury evaluations now for training that, focus on good patient care, good FDA approved diagnosis, and if you focus on the good service, the rest will follow. But that's the thing, is just build the skill set in TBI. And like I said, Quick Impact is a great tool to have because it's FDA approved.
Got it. And if you want more information on how to get certified with impact test or how to get with Braincussion, just reach out to me. My clients know how to reach me via email, phone call, Facebook, LinkedIn. I'm available to help you and walk you through this process. Dr. Connelly, I want to thank you so much for joining me on this interview. I value your opinion. I love the work that you're doing. I know we've met several times over the past 6 months. We've had awareness of each other for years, being in Atlanta, being chiropractors. So again, sincerely, thank you so much for doing this interview. And before we sign off, any last minute parting shots you want to add? Anything you want to get off your chest before we end the interview for today?
No, thank you for having me, and thank you for creating awareness about brain injury. Braincussion, although we provide care for patients, our main mission is to help create awareness. Whether you use this or not, it's still important to get a good diagnosis if a patient has a brain injury. So thank you for creating awareness about brain injury. And I'm the Chief Education Officer, so I'm here to help in any way possible for brain injury, whether it be the entry level, whether it be impairment ratings, anything of that nature. So anything I can be of service to you or your clients, just let me know.
Okay, and if my clients want to reach out to you, I can share that information. I don't want to do it on this video because I know how busy you are, and I can help them walk them through the process. So again, Dr. Connelly, thank you so much for joining us. Have a great day, and I know I'll see you soon. And again, thanks so much for doing this interview.
Thank you for having me.
All right.